Hello CCNZ members and supporters. I thought I'd make a short video today just to address some of the challenges and questions around the COVID vaccine and how it is potentially going to impact our sector. And there's questions. There's questions about whether it's going to be compulsory or not, whether vaccine passports are going to be a thing, and there's some really strong positions and opinions when it comes to this whole topic. So I am going to be reading from my notes a little more than I would normally because I want to be precise as I talk about this. I've been in discussions with the Christian Venues Association in Australia. I'm just trying to understand their experience. They're probably a little bit further down the track than we are in terms of their exposure rates. And I've also been in contact with the advocacy manager at Recreation Aotearoa, and he's been asking some of these same questions of Minister Chris Hipkins on behalf of the outdoor and recreation sector. So the purpose of this video really is to share with you some of what I've learned from those conversations. But before I do that, I've got a couple of thoughts that I want to share relating to how we respond to this whole discussion. Regardless of where you sit, there are some general principles or guidelines that I think are pretty important and that I'd like to just remind us of. Firstly, if you're going to advocate for a position when it comes to vaccines, that's different from determining for yourself what you think. But if you're going to advocate, please be balanced in your approach. One thing that higher education has taught me is that alternative positions exist for a reason, and that's generally because they have merit. Good people with good hearts and good intentions can still disagree with us, and they do, and that's okay. Secondly, statistics are a heartless tool. They don't account for the pain or suffering of the individual. If you're lining up anecdotes against statistics, the anecdotes are far more powerful in eliciting emotion. That's why mixed methodology research is so powerful, because you have the data from the statistics, but you also have the human element, the emotional element of the interviews that you might do with individuals, the individual stories. However, statistics do provide necessary generalizations, and they are the right tool for the job when making decisions on a large scale, like decisions for a nation. So please remember those tensions in your conversations. Statistics are good, but they're also limited. Thirdly, and probably most importantly from my perspective, as Christians, we need to protect our relationships with each other and keep them sweet. This whole discussion has the potential to cause significant partisanship within the church, but we're called to be known by our love for each other. The theologian and church leader Tim Keller once said, "Be known for what you stand for, not what you stand against." And I think probably that's an important message for us today. We're not called to be followers of a vaccine or oppositions to a vaccine. We're not called to be followers of a political movement. We're called to be followers of Jesus and to promote his kingdom. So let's keep that in focus, even when we may be having discussions and disagreeing with our brothers and sisters. So what are the trends relating to COVID and the whole vaccine situation internationally? There's a couple of examples that I'll just quickly draw your attention to. Singapore currently is almost at 80% of its population vaccinated, and they're no longer reporting COVID infection rates. A little bit closer to home, New South Wales, they will reach 80% vaccinations for their population by the end of the year, and the infection rates are no longer being presented as the first item in their press conferences. The first item in their press conferences now are vaccination rates. How are we going getting to this 80% mark, which is kind of the herd immunity number that they're touting? So internationally speaking, eradication is no longer really being considered a realistic option for COVID, and management is becoming an increasing focus. And so the question really for us is, how do we manage it? Based on the international experience, New Zealand is likely to be engaging and negotiating with that same question. How do we manage it? Because COVID in the community is likely to be a reality in the future. Vaccinations currently, obviously, are part of that. They're part of that that situation, that discussion, but they are compulsory in New South Wales for health workers, and they're going to become compulsory for all school staff and service providers for schools as well. And that's going to come into effect in November. So The Christian Venues Association is seeking guidance on whether that will include camps, but it's likely that it will. Now, that's not New Zealand. In New Zealand, the minister has clarified that it is illegal for an employer to require an employee to be vaccinated. However, he also indicated that vaccination could be an item for negotiation in the employment process. And negotiation is an important word because it can't become a requirement of employment. There is a little bit of conflicting information around this whole discussion as well. WorkSafe explains that an employer must undertake a health and safety risk assessment in order to determine if vaccination could become a requirement of employment. So in short, this is really an emerging discussion, and the guidance that exists is not entirely clear, and the application of the principles that the guidance is based on may mean that the response could change significantly as our national position around COVID changes too. For example, if we learn to live with COVID in the community, the situation to justify the standard of having a risk of exposure in terms of that health and safety assessment will exponentially increase. There's way more opportunities that there will be a real risk of exposure, whereas currently it's only at the borders. So that will certainly change the way we respond, and therefore what sort of health and safety measures may be put in place. There is a situation in the very near future where health and safety and human rights, those legislations, are going to be clashing around this, almost certainly. It's not a new thing. We have it in lots of different areas. Assuming that the government does not change their position and require vaccine passports or anything like that, there's still an important point to consider for us as camps. There's currently no approved vaccine for those who are under 12 years old. And if we end up learning to live with COVID in the environment, in the community, given that children are susceptible to the Delta strain, we need to consider how schools are going to respond and what sort of safety precautions they're going to want to put in place. And I think it's entirely likely that a school may ask a camp if all of their staff are vaccinated, despite the fact that that question is actually illegal. If this situation does eventuate as well, I suspect that the illegality of that question will probably be challenged on the grounds of health and safety. They'll want to be able to ask it, and they'll feel like they should be able to get an answer. So that's where we're at. The new guidelines for level 2 are still being developed by the government, and we're working with Recreation Aotearoa again to update our level 2 guidelines for outdoor activities and facilities. So that's that document that we put out last year. We took the lead on that. We're working with them again to modify it this time round. When we have an approved and amended version for these, we'll circulate them, but really we're waiting for the government to finalise what their requirements are going to be before we can finalise that document for you. The one change that we are aware of already is the compulsory tracing, and there's been a little bit of clarity around that. As you know, visitors must either use the Tracer app or a paper sign-in. However, the onus is not on you as a business to make sure that happens. You need to provide the QR code and a sign-in sheet. The liability, though, the onus, is put onto the public. So that's good news for you in terms of liability. So if you have any questions around this, please get in touch with me, but I don't have all the answers. I don't have much more than what I'm sharing with you now, and it's an emerging situation. With regards to positions on vaccines and whether to do it or not, I'm trying really hard not to promote a position, but instead to promote principles that I think are important for us to remember, particularly as Christians who are called to be known by a love for one another. So God bless you. May He keep you safe, and as always, let us know if we can serve you in any way. That's what we're here for. Bless you guys.